Hello, and welcome to Let's Play Doctor. This is Dr. Joel Wallach, your host, and thank you so much, Melissa, for setting everything up. Okay, remember, I'm the guy who got rid of cystic fibrosis, supposed to be a genetic birth defect. I got rid of it. I got rid of muscular dystrophy, supposed to be a genetic disease. I got rid of it. I got rid of sudden death syndrome, supposed to be because mothers were laying on their babies and suffocating them. I got rid of it. I got rid of congestive heart failure in dolphins and whales and porpoises and big aquariums around the world. Okay. I got rid of, let's see here. What else? Liver cancer in bears. In every zoo in the world, every species of bears was getting liver cancer. No other animals in the zoos were getting liver cancer, just the bears. And okay, so that had to be something that all the bears were doing. Well, they were feeding them peanuts. They were selling peanuts so that people could throw peanuts at the bears, but they were making money to run the zoo from selling peanuts. And so I eliminated all those problems, okay? My team and I, okay, we actually got together and made programs for each one of these problems and got rid of them in weeks and months. And there's, dozens of other things that we know what the answer is. For instance, let's see here. Let's talk about when you're looking at the American population, and you say, well, why are there so many people getting high blood pressure? Oh, it's genetics. Their families. No. What about them eating so much fried foods and salt and that kind of stuff? Okay, salt is good for you. But not when you're not taking the 90 essential nutrients. You take the 90 essential nutrients. I use salt in every meal. Okay, it was the first supplement that human beings took as a supplement thousands of years ago was salt. Okay, salt is a requirement. Sodium chloride is a requirement. So, at any rate, I predict if we do everything correctly here, that we can eliminate the metabolic syndrome. We can eliminate these diseases that make up 25% of the human population in the United States. We can end this in 2 to 3 months. Okay, we're in the process of eliminating, the metabolic syndrome in the form of all these diseases here. Okay, Parkinson's disease, Alzheimer's disease, multiple sclerosis, amyotrophic lateral sclerosis, Huntington's chorea, frontotemporal dementia, Charcot-Marie-Tooth, Bell's palsy, and all these various neuropathies. Okay, and we get rid of it by giving them the 90 essential nutrients, okay, which is part of our flip chart, okay, the 90 for Life crusade to save humanity in the world, okay? And so we have to watch it because right now Parkinson's disease has gone up 50% in the United States for many years, many years. There's 60,000 new cases every year in America of Parkinson's disease. This year, just a couple of months ago, it went up to 90,000, went up 50%. Okay, that's because the doctors are telling them, no cholesterol, no eggs, none of these things. And all the things you need, the doctors are telling them to get rid of. Okay, so don't forget the metabolic syndrome, all these nutrients, the healthy brain and heart pack, and then the secret sauces for each one of the diseases that they have. And guess what? We'll be able to eliminate the metabolic syndrome in America. We'll be a leader to the world. Okay, with all that said, Melissa, you want to start going to callers?
Yeah, let's start with Rita from California.
Okay, Rita, are you there?
Hi.
How old are you?
59.
Okay, you're 59 years old. Okay, 59. And how much you weigh?
180.
Okay. And how tall are you?
5'6".
Okay, now, what are your main problems here?
Okay, I just want to say right off the top, my weight is heavy because I'm dealing with a severe hip injury on both sides and can't do much activity at the moment. But
Wait a minute. When you say hip injury, do you have arthritis of the hips? Were you in a car accident or what?
Deteriorated. But that's not why I'm calling. If I could just, the main reason why I'm calling is I was even worse than that. I was diagnosed with 4-stage lymphoma cancer.
Okay. All right.
Yeah. And And if I could just make a few quick statements, and then I have some specific questions regarding a few things, if I may.
Okay, well, let's go quickly because we have other callers.
Right. Yeah. So, and I've known about you for quite a while from KFI George Norrie's show, and had always been very impressed. Yeah, very impressed with everything I heard over time. And so, upon reaching your company to get on the product right away, the representative, I'm a little concerned at what they advised me to take and how much. And then also one of your star products, the Beyond Osteo Powder, which is part of my regimen, I'm being recommended to take about the amount that would give me 200% of the calcium that I would need on a daily basis, where my doctors are telling me not to take any calcium because my lymphoma cancer is releasing calcium out of my bones into my bloodstream.
Okay.
So I'm concerned.
Stop there. Okay. If your bones are releasing calcium, that means you have osteoporosis, you have arthritis in both your hips, okay, and you're losing all the calcium out of your bones, and they're telling you not to take calcium. These doctors need to go back to school.
The cancer, they said, is triggering that. I never have high calcium levels ever. This is only since cancer. Mm-hmm. Yeah, so I'm concerned about what I was recommended to take and how much, and also, I was strongly recommended by the rep not to do chemo, which is not what my doctors are recommending.
Okay. Well, here.
And so I'm concerned.
Okay, let's stop there. You need to make some choices. Number one, okay, and you have tinnitus. You have ringing in the ears, right?
Yeah, that's something else too. Yes.
Do you have a balance problem? I would think you would with the hip stuff.
No, not really.
Okay. Well, tinnitus, ringing in the ears. Okay. Shh. Tinnitus, ringing in the ears, is due to osteoporosis of the skull, okay, squeezing the eighth cranial nerve, okay? Because you don't just get osteoporosis of your hips. When you have osteoporosis, you got it in every bone in your body, okay? It's just a matter of which one is where you're going to get symptoms from, okay? If you're used to dancing every Friday night, well, if you got hip osteoporosis, you're going to notice that right away, right? And so, but apparently you're taking a few products, okay? You're taking some selenium, you're taking some osteo, okay? You're taking oxybody, you're taking enzymes, correct? You're taking glucogel, which is our cartilage rebuilder, okay? Fucoid C.
Yeah, but I'm considering...
Go ahead.
I'm concerned about the amounts I'm being asked to take, and I'm not taking the Beyond Osteo because, as I mentioned, it has the amount that she wants me to take has 200% of calcium, where my doctors are telling me not to intake any calcium.
Well, no, they have kids in college, and they need to do the surgery so they can put the kid through college.
I'm sorry, I missed that, doctor. What did you say?
The doctors have kids in college, and they need to do the surgery so they can afford to send the kids to college.
No, they're not saying surgery. They're just saying chemo at this point.
Oh, okay. Okay, they're telling you chemo because of the cancer, the lymphoma.
Correct.
Okay. So what you need to do is work on your immune system. Okay, your immune system is the only defense you have against cancer, your immune system. Okay? And again, this is where the metabolic syndrome comes in. And so you need to be taking the 90 essential nutrients. At 179 pounds, you take 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Take a full dose of everything twice a day. Okay? Then you need to take our selenium for your immune system because you have cancer. I'd go ahead and take 3 of our selenium at breakfast, lunch, and dinner. That's 9 a day to our selenium. And the oxybody will also help you. Okay? And let's see here. The glucogel. Okay, glucogel rebuilds cartilage and ligaments and tendons and connective tissue and skin and all that kind of stuff. Okay, so the glucogel, I'll go ahead and take 3 of those 3 times a day. Okay? And for energy, go ahead.
No, I was just told to take 4 at a time, 2 times a day of the glucocel, but...
Okay, that's fine. That'll work. Okay, so let's start there. When do you need to go to see your doctor next?
In a few days, we're doing something over the phone, and then I have to keep checking my calcium because it keeps shooting way up at dangerous levels.
Mm-hmm. Well, that's because you're losing it out of your bones. So you have to take enough outside calcium to prevent your bones from releasing calcium, because these things are not like poured concrete. They're very, very, what should I say, it depends on whether you're taking a lot of calcium in, they'll deposit in your bones. If you're not taking calcium in, you take it out of your bones, okay? And so this is why you need to be taking your calcium, so that you're taking in enough calcium so that you're not taking more calcium out of your bones.
Apparently, it's also getting into my bloodstream quicker and raising it to levels of... So in other words, the calcium I'm taking in, as well as the calcium being released from the bones and going into the bloodstream, collectively is putting me at dangerous levels very quickly. Mm-hmm. According to the doctors, that it's not just my bones releasing the calcium, it's any intake of calcium is dangerous, they said, too.
So how are you supposed to stop calcium from your bones if you're not taking in calcium?
By treating getting the cancer to stop, they say.
No, that won't work.
Yeah,
you need to treat the cancer, but it's not going to do anything for your calcium in your bones.
And what are your thoughts about doing chemo?
Well, that's everybody's choice, okay? But your immune system is your best friend when you have any kind of cancer, your immune system. And, of course, that's what the selenium's for, is your immune system, and also the glucogel, because it helps your bone marrow be happy and healthy, so it can make white blood cells. Your white blood cells are amongst your best friends. I didn't hear anything about white blood cells. They're your best friends against cancer is your white blood cells. They're made in your bone marrow. If your bones are losing calcium, your bones are busy trying to stabilize calcium instead of making more things like white blood cells and stuff like that. So your bones are all messed up, okay? And so you have to think, okay, I got to take in enough calcium to stop the loss of calcium from my bones.
Okay, but what about when the calcium levels reaching numbers that they literally said I could die? It's almost at a 14.
Mm-hmm. Well, I'd get another opinion from another doctor at the other end of town.
Okay. And then there is an alternative treatment I was wondering if you heard of, and I was very excited to hear instead of chemo. Have you heard of CAR T-cell treatment, where they take your T cells and they mix it with the medicine, put it straight in your body, and apparently it goes straight to the cancer cells and kills them without chemo?
Mm-hmm. No, those kinds of things are worthy. If you take cells that support your immune system and grow them, and then take the grown T cells and inject more of them into you, okay, that's useful. Yeah,
that's kind of, and it's done through Gilead, which is supposed to be a pretty renowned medical research company.
Okay, well, I'm going to turn you loose, and then let us know, as you go along here. Every time you get some kind of exam or you get some sense of what's going on, give us a call every week or two, okay?
And one last question real quick, Doctor, is I know this is going to vary from person to person, but on average, the whole program that I'm taking here, which you just reaffirmed what I should be taking, and I appreciate that, on average, when does a person expect it to be making a change in their body against cancer in my case?
Well, that's hard to say. It depends. Are you eating gluten? Do you eat wheat, bran, and oats, or buckwheat?
Probably very little, but I should check that to eliminate it completely. You
have to eliminate it completely. If you're taking in one seed of wheat, that's enough to destroy the lining of your intestines, so you cannot absorb all the nutrients you're taking orally, or all the medication you're taking orally.
And by the way, I have zero appetite right now, which is a little scary. Mm-hmm. Yeah.
Okay. Well, do what you can do, and then call us in a couple of weeks. Get another opinion.
Thank you.
You bet. Melissa.
Let's go to Kenneth in Oklahoma. Kenneth, you're on with Dr. Wallach.
Yes, sir. How can we help you?
Yes, sir. I have a question secondly, but first my wife wants to ask you a question. Her name's Rhonda.
Hi, Dr. Wallach.
Hi.
I have oily hair. I can wash it, and then 3 days it's back again.
Okay, I missed that. You have what hair?
Oily hair.
Oily. Okay, oily hair. Okay. Mm-hmm. Okay. Are you taking supplements? Are you taking vitamins and minerals?
Yes, I am.
Mm-hmm.
Healthy heart and brain, and the minerals.
Okay. We have a wonderful product called Hair, Skin, and Nails. How much do you weigh?
190.
Okay. Do you have any other issues like high blood pressure, diabetes, arthritis, anything like that?
No.
Edema.
Edema.
Okay, edema in your legs or?
Yes. Thighs and legs and hands.
Okay. So I also need you to take our Ultimate Daily Classic tablets. Take 3 of those twice a day. And that's going to help you get rid of the edema by making your kidneys work better. So your kidneys will make more urine, okay, to urinate out the edema. And how tall are you?
5 foot.
5'0"?
Yes.
Okay. So, 190 pounds. You're a little overweight there. And so you need to be taking these minerals so you're not hungry for minerals. But some of that's probably due to the edema you have in your legs. You could have 20 pounds of edema in your legs. Okay. And so don't forget hair, skin, and nails. Go ahead and take, you could take 2 or 3 of those twice a day. That's going to help make your hair healthy. But don't forget the Ultimate Daily Classic. That's going to help the kidneys do their job. Okay?
Okay.
Melissa, are we going to Donald in North Carolina?
Yes, we are. Donald, you are on with Dr. Wallach.
Thank you. So God bless you, Dr. Wallach.
Well, thank you.
I've been yes, sir. I've been diagnosed with AFib, and I want to talk to you about which supplements of yours do I need to get on.
How old are you and how much do you weigh, sir?
I'm 73, and I weigh 280.
73, okay, and 280 pounds. Okay, do you have any other issues like arthritis, osteoporosis, high blood pressure, diabetes?
High blood pressure.
Okay, all right. So you need to get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, no bran, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet ones got to go. And then at 280 pounds, I want you to have 3 healthy brain and heart packs per month. Okay, if finance is an issue, don't go any lower than 2. Okay, so that's a minimum of 2 doses a day. But if you can afford 3, go for 3 and take a dose of breakfast, lunch, and dinner. I weigh 142 and I take 2 doses a day. Okay. Of the Healthy Brain and Heart Pack. Then I also, because of high blood pressure, I want you to take the Ultimate Daily Classic tablets. Go ahead and take 3 of those at breakfast, 3 at lunch, 3 at dinner time. Ultimate Daily Classic tablets. That'll be a couple of bottles a month. And that's going to support healthy blood pressure and healthy blood flow through blocked arteries in your kidneys, which are really in charge of your blood pressure. Okay. Now your AFib. Okay. Let's see here. I want you to take some extra selenium. We can go ahead and take 3 extra selenium at breakfast and 3 at dinner time as an addition to what's in the Healthy Brain and Heart Packs. Okay. And let's see here. Let's go with that. And if you do this, you're not going to be really hungry and you'll begin to lose some weight on this program. And let's see here. Again, we do have an energy drink if you need energy. Okay, it's the Rebound or a sports drink. Okay, and the sports drink Rebound, you can go ahead and drink 1 or 2 of those a day, but you want to be sure that you don't add other things to it. Okay, it's an energy drink, and it will give you the energy you need to play sports if you want to, take long walks if you want to, that kind of stuff. It'll give you the energy you need so that you're not craving food. All right?
Yes, sir.
Okay. Well, give us a call every couple of weeks. And I'm sorry, go ahead.
Yes, just real quickly. So, they have me on medication. So taking your supplements is going to help me to begin to wean off these medications.
Well, as you see your weight come down, as you see your blood pressure come down, you can begin to reduce the medication based on what your blood pressure is. Okay?
Okay. Yes, sir.
Don't just stop taking your blood pressure medication, but you can slowly reduce it based on your readings of your blood pressure. Okay?
Yes, sir.
Blood thinner.
Give us a call.
And one more thing.
Yeah, go ahead.
Yeah, one more thing. The so-called blood thinner.
Mm-hmm. Are you taking blood?
The same thing. Yes, sir. They had me on Lopressor, Xarelto, and Entresto.
So they got you on 3 blood thinners. Do you have a history of blood clots or stroke?
No, sir. No, sir.
Okay. You might want to see another doctor because that sounds awful high for me to see somebody taking 3 different blood thinners. Okay.
Doctor,
I think that's too much.
This is his wife. The doctor said that one was a blood thinner, one was for high blood pressure, and then one was for heart failure. But they all, you're saying they all.
Yeah. Well, I wouldn't just quit. I'd get another opinion from another doctor somewhere.
Okay, I see.
It's not in the same group. Okay.
Okay. All right.
It's something that's important. Don't feel bashful about embarrassing the doctor. You want to make sure you're getting the best information, so you want to get a hold of another cardiologist at the other end of town.
Right. Okay. And you're so well, Doc. I'm glad Melissa told me you're going to send all this to my email so I can have it right in front of me.
Okay.
That's correct.
All right. Thank you. God bless.
God bless you.
Welcome back, everyone. Dr. Wallach, we're ready for the next segment.
All right. Let's see here. What do we have?
We can go to Ella.
In Virginia?
Yes.
Okay, Ella, what's going on? Your husband has a problem?
Yeah, I was calling to, can you hear me?
Yes.
Okay, I was calling to give you his improvement. He's walking better now. Before, as I was stating, from all the coughing and vomiting and all of that, that has ceased, and he's walking now. He's not weak. He's not coughing like he was. And I found out the reason why that he slept a lot. It was due to the cough medicine that he was taking that caused shortness of breath, caused him to sleep a lot, shallow breathing. Mm-hmm. And that's what made him go through all those stages. So I had to research on that. Also, started taking the de-stress. I'd have moved it up. How many would you like for him to take that for that, his heart and everything?
How much does he weigh?
He weighs 161, height 5'8", age 77.
Okay. And so the de-stress, let's see here. You go ahead and, let's see here. I would go ahead and have him take 3 twice a day. That's going to support healthy heart function. That's one of the products I invented. Okay, for congestive heart failure, which causes a lot of coughing and that kind of stuff. Okay. So, de-stress, he can take 3 of those twice a day.
Okay. So what I'm doing now, we're taking him to another doctor instead of the same doctors we had. Because the doctor that we had 2 years back when we went there because of his coughing, they said that his heart rate was still at 10 to 15. I told him I don't believe it after 2 years because before they couldn't find nothing, didn't hear nothing. But these same doctors that had him before was trying to say that everything that he had was still going on. So I told him I didn't believe that. So we're going to a different doctor.
Mm-hmm. Okay, well, keep us informed. And, and he weighs what again?
He lost he had a lot of fluid. So he was 173, he's down to 161.
Okay, yeah. And so he can take 2 Healthy Brain and Heart Packs per month, take a full dose of everything twice a day. Don't forget the Ultimate Daily Classic tablets, 3 of those twice a day. That's going to help his heart, that's going to help his kidneys, that's going to help his blood pressure. The Ultimate Daily Classic tablets, I do that, and I weigh 142. Okay?
Okay.
So, that's the Ultimate Daily Classic, all right?
All right. Okay, thank you, Doc. And I'll be
keep us informed, and congratulations on all your good work.
You're welcome.
All right.
Welcome to the Let's Play Doctor Show, your daily dose of wellness and vitality. This is where health meets hope. Join us every weekday with the one and only Dr. Joel Wallach. He's a renowned expert in nutrition, and he's here to guide you through your health challenges with the life-changing benefits of the YOUNGEVITY brand of nutritional supplements. Do you have health questions? Do you need personalized advice from Doc himself? This is your chance. Call us at 877-912-7529. That number again is 877-912-7529 and be part of the conversation. We're live at 4 p.m. Eastern, 1 p.m. Pacific, waiting to hear from you. Miss the show? No worries. Leave us a message anytime at 877-912-7529 and we'll get in touch to feature your question on the next show. Remember, it's 877-912-7529, your hotline to health with Dr. Joel Wallach on the Let's Play Doctor Show. Back to you, Dr. Wallach.
Okay, we're back with Let's Play Doctor. Let's see here. Melissa, let's go to Grace in Texas. Okay, Grace, you're on the air.
Hi, Dr. Wallach.
Hi.
Hi. I want to say after 7 months of fighting for my life and 3 naturopath doctors and a traditional doctor, you're the first product that's given me any relief. So I'm so grateful to have you on the call, and I want to thank you for that. It seems now that after this long journey, over my 7 months of healing from rolling my car and cracking 2 vertebrae in my neck, turns out I was drinking mold out of my water bottle, which now in the end game here has caused me to have, I don't know if it's acid reflux. My doctor gave me Dexalin. It seems to help, but I have a lot of mucus and phlegm, and I have this wrenching tightness in my chest and this nervous energy in my body. And I'm taking the 90 nutrients and the enzyme pack. But I'm wondering that, number one, is am I still able to eat everything on the good food list? How do I deal with this nervous energy? And is there any other product that you can recommend to heal this? Because I don't know if it's mold detox and fungus and microbial or acid reflux, because I don't get indigestion or heartburn. I just get this gut thing going on in my chest and in my, it's horrible.
Okay, how much do you weigh?
I'm 112 pounds. I've lost 25 pounds since my accident, and I want to gain some weight, too.
How old are you?
63.
Okay. All right. Now, the thing you have to look at is you need to be taking your 90 essential nutrients, and you say you're taking 112 pounds. You want to take 1 healthy brain and heart pack per month, take a half a dose of everything twice a day, get rid of all the bad foods so you can maximize absorption, no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, iron, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. Okay. And then I want you to, let's see here. Do you have any, like, ringing in your ears or dizziness or anything like that?
I do not. I had a little bit of tetanitis about 3 months back, or ring, like humming. I thought it was tetanitis, but it seemed to go away.
Okay, since you've been taking some products, it's gone away.
Yeah, it went away before the products, but I had insomnia, severe anxiety, loss of appetite. I've been on your products just at a month, and I'm starting to sleep at night. My anxiety's come way down. I still have this nervous energy in my body. I think it's from my belly being so far out of whack. But yes, I've always been healthy. I don't have high blood pressure, no high cholesterol. I'm super preferred. I have infrared sauna. I mean, I'm super healthy. Take care of myself. This is just brutal. That's all.
Okay. So, in addition to the Healthy Brain and Heart Pack, I want you also to get 1 bottle a month of the Ultimate Daily Classic Tablets. Go ahead and take 2 of those twice a day. That's going to help you with blood flow through blocked arteries in the brain and the heart and the kidneys and so forth, and keep your blood pressure happy and so on, okay? And also, I'd have you take our Ultimate Enzymes. I take 3 of those twice a day, the Ultimate Enzymes, okay? And that helps you digest food. Let's see here. And also can help eliminate the acid reflux, that kind of stuff. Because you do have some is this osteoporosis you have?
No, I don't have anything. I just have digestion. I just have, my back, my neck hurts and stuff. I take the OsteoFX product, and I take the glucogel because I wrecked my car, and I've been sleeping on my side for the gastric reflux, so my back and my spine and my neck and my shoulders are kind of jacked up.
Glucogel is going to help with the disc between the vertebrae also. Okay, good. Okay, good. And you can actually get some CM cream, and you can rub that on the back of your neck, in between your shoulder blades and your lower back, and that's going to help you reduce a lot of pain and discomfort and swelling. Or CM cream, go ahead and do that. And then, let's see here. I would also have you take our I-26. I like the soft chewables. I like the French vanilla. I take 3 of those twice a day. It's very tasty, and it's soft chewable. They're so soft, even a baby with no teeth can chew them, okay? Soft chewables. And the I-26. And that will help rebuild your brain, your spinal cord, and the coating on the large nerves, okay? And so it's the raw material for your body to make those materials. And people are following their doctor's instructions. No cholesterol. Stay away from fat. I'll give you pills to lower your cholesterol. Well, that's going the wrong direction because your liver takes cholesterol and turns it into myelin and rebuilds the white matter in your brain. Your brain and your spinal cord are very, very important here when it comes to these sorts of things that you're kind of suffering through, okay? So the I-26 will be a great addition also, I-26, okay? And give us a call every couple of weeks, and we'll walk you through this.
I will. Dr. Wallach, is it okay to take, is kombucha okay to drink? It's not carbonated. It's like I've been taking it because it seems to help me burp when my belly gets all weird, but you're saying no carbonated, and kombucha is kind of carbonated, because it's fermented. Is that not good? And is there anything I can take for this nervous energy? I-26 going to calm my nerves?
Yes, it's going to calm your nerves. And the kombucha, what you want to do for that is pour your glass you're going to drink a couple hours before you drink it, and let the carbonation off.
Okay. But just the carbonation helps me burp. That's why. But that's okay. I got that. And are you thinking, I heard you say at the very beginning of the call, I've been on the product 30 days. I'm starting to see a little bit of relief. Are you saying maybe 60 to 90 days I should see healing on my digestion and my acid reflux? And can I come off my Dexalent? When can I come off my prescription? I don't like anything prescription, my acid reflux pill that I'm taking.
What you want to do when you have a prescription, when your symptoms are getting better, you want to make an appointment with your doctor and say, look, I'm really, I've changed my diet. I've done a lot of things here. I'm feeling a lot better, and I would like to reduce my medication. Let the doctor do that.
Okay. I tried to come off it last night, and that wasn't good, so I took one. But,
no.
Okay, I don't want.
Don't
do that. Huh?
No, you let the doctor give you the instructions, but you can take anything that's carbonated and pop the top or pour it and leave it in the glass for a couple of hours before you drink it, and it's been off-gassing most of the gas. Okay.
Okay. Thank you so much, Doctor. I can't tell you how much I love your product. I've been in the health and wellness industry for 30 years, and I never heard of your company, and it's changed my life. I'm thrilled. Thank you.
Okay, well, thank you for the kind words. And this is, we actually made this product to begin with for professionals in the alternative health industry. But it got so big that they couldn't handle it. So that's why we turned it into a company where everybody could get it. Okay?
Yes, and one more thing. Can I eat all the foods on the good food list with acid reflux? Because I'm hearing no butter, no bacon, no this, no that. If you have acid reflux, don't do this, don't eat that. And I'm thinking...
Wait a minute. Whoa. Bacon is not on the good food list. It should not be on the good food list. Okay? No wheat, butter, and oats, no buckwheat, no sugar, no carbonated drinks. And so absolutely no... when you're looking at meat, you don't want the carbonated drinks. Also, you don't want to be eating things like bacon, ham, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam. They all have nitrates in them. Terrible, terrible, terrible. Bad for your liver, bad for your heart, bad for your brain. And so you want to stay away from all those processed meats. Okay?
Okay. All right. Everything else is okay with my acid reflux on the good list.
Should be.
Perfect. Thank you, doctor.
Okay. Yeah. And let us know what your doctor says, and if they pull you off your medication and so forth. Okay.
All right. And then, Melissa, I guess you email me all the stuff you just told me I need to take, because that's what the other guy said.
I'll email you a copy of the show.
Perfect. Thank you.
Okay. God bless. We'll be right back in just a moment.
Welcome back, everyone. Dr. Wallach, we are back and ready for more. John, you are on with Dr. Wallach.
Thank you so much. Hi, Dr. Wallach.
Yes, sir. Where are you from, John?
I'm from North Carolina. I have a more complex case today, and it's my brother-in-law. He's at the VA, and he went to have an iron infusion, and he had an anaphylactic shock, and from that point on, he's declining, and he also contracted COVID. That's over today, so they're putting him down into hospice. So I was wondering, he has...
how much does he weigh?
Things I've been doing. Right now, he weighs, because of the fluid, he weighs 200. He's 6'1". He's 86 years old, but his normal weight is 175. He has cirrhosis of the liver. He has kidney failure. He has Crohn's disease or celiac, and he's really swollen. And
okay.
Lymphedema. Okay.
Let's stop there. And you say he weighs 200. Let's have him get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no bar, rye, oats, no buckwheat, no sugar, no carbonated drinks. The diet one's got to go. We want him to have 2 healthy brain and heart packs per month. It's full dose of everything twice a day. He also needs the Ultimate Daily Classic tablets. I want him to take 3 of those twice a day. That's going to help him with edema and fluid. Okay, and he needs. Let's see here again. The Ultimate Daily Classic. That's very important that he take those. Ultimate Daily Classic. That's going to help his kidneys. That's going to help his liver. That's going to get rid of the edema. Okay, and then if he has, does he have an actual infection, or are you just concerned about COVID, or what?
Well, it's just a concern because I think everything else is declining, and he has some difficulty swallowing. So what I've done in the past, I've used the plant-derived minerals, and I placed that on his chest.
And don't forget the EFAs. He needs EFAs, the essential fatty acids, to prevent blood clots.
Okay, so I guess I can squirt that over
3 of those.
Food.
Yeah, he needs 3 of those 3 times a day to prevent blood clots. There'll be 2 bottles a month, I think.
Okay. Is the blood clot related to the swelling or the...
Not necessarily related to the swelling. The blood clots can be due to kidney issues. It can be due to deficiencies of nutrients. It can be due to eating fried foods, and the fried foods are causing inflammation in his arteries, and the arteries in his kidneys are closing up. And so, there's all kinds of possibilities.
Okay. So the healthy brain and the heart.
Healthy brain and heart.
The
Ultimate Daily Classic.
Minerals.
The Ultimate Daily Classic and the plant-derived minerals and the EFAs.
I have all of that here.
Okay, good.
Okay.
Okay, then give us a call. Let us know when he sees a doctor again. So we're going to see if he's staying the same. Is he improving? Is he getting worse? We need to know what's going on, okay?
And he's not on any medication except for the supplements that I'm giving him, except for pain medication. So
well, make sure he's staying away from the bad foods, because those are the things that cause all the problems in people.
Okay. See, with him being in hospice care, sometimes we can monitor that, and
well, he has to know what to do, so he's going to make food choices.
Well, yeah, that's true. That's true. And he has, since the anaphylactic shock, he has trouble swallowing. So,
yeah. Okay. Yeah, he may have osteoporosis of the skull if he's 86 years old, squeezing the 12 pairs of cranial nerve and the spinal cord. And we literally see hundreds of patients every month who have osteoporosis of the skull. And their doctors didn't diagnose it because they don't believe in osteoporosis above the neck.
Oh, okay.
But believe me, that's why people lose their teeth.
And the ringing in the ear, that's the cause of that, too.
Tinnitus, ringing in the ears. The 8th cranial nerve is being squeezed by the skull. And a very important picture in that book, It's All in Your Head, on page 6, there's a picture of a normal skull, which has been cut through, which is a 1/4 inch thick. And it shows a skull with osteoporosis. It's 1.5 inches to 2 inches thick. You can imagine the 12 pairs of cranial nerves all coming through the skull. And the holes that they were going through, the inside diameter has been reduced by 90% because of that increase in the bone mass because of osteoporosis.
Thank you so much. I'm gracious for your efforts and your time. Thank you. God bless you.
Well, God bless you, sir.
Well, Doc, you have spent so much time on the phone today, and I really appreciate it. So you've conquered oily hair, blood clots, AFib, acid reflux, lymphoma, kidneys, and the list goes on and on. I really appreciate your time, and I thank all of our callers and our listeners as well. If you ever need to talk to Doc, just give us a ring at 877-912-7529. Love to hear from you, and Doc would as well.
Okay, well, yes, thank you so much, Melissa. God bless you and all the great work you do. Make sure everything stays on the rails. Thank you so much for all that.
My pleasure. Have a good day, everybody.